Most dangerous illnesses don't arrive dramatically. They arrive quietly. They arrive disguised as normal. A headache, fatigue, mild nausea, a vague sense of not feeling right. Symptoms so common, they rarely trigger alarm. That's why they're missed. Not because doctors are careless, not because patients ignore them, but because medicine is built to recognize patterns, and some of the most dangerous patterns look ordinary at first. In the early stages of serious infection, the body doesn't fail loudly. It compensates. Heart rate increases to maintain circulation. Breathing speeds up to deliver oxygen. Blood vessels adjust to keep pressure stable. From the outside, this can look like stress, or anxiety, or dehydration. The body is working harder to appear normal. Fatigue is one of the most common early symptoms. It's also one of the least specific. People describe feeling drained, heavy, unable to focus. This is often dismissed as lack of sleep or viral illness. But fatigue can be the brain responding to subtle drops in oxygen delivery, or early inflammatory signaling affecting energy metabolism. The body is already adapting. Headache is another symptom that blends in easily. It's common, expected, often ignored. But in systemic infection, headache can reflect changes in blood flow, inflammation, or early involvement of the central nervous system. It's not always severe. That's what makes it dangerous. Nausea and appetite loss are frequently overlooked as well. The digestive system is highly sensitive to stress and inflammation. When the body enters a state of systemic response, digestion is deprioritized. Blood is redirected. Motility slows. The result feels minor, but it's a signal that the body is shifting into survival mode. Changes in mental clarity are among the most important and most missed signs. People may feel foggy, slower, less sharp. They may struggle to find words or follow conversations. This is often attributed to exhaustion or emotional stress. But the brain is one of the first organs affected by changes in circulation and inflammation. Confusion is not always dramatic. Sometimes it's subtle, and subtle changes are easy to rationalize. Vital signs often reflect these shifts before symptoms feel severe. A heart rate that remains elevated at rest. Breathing that stays faster than normal. Blood pressure that trends downward but hasn't collapsed. Individually, these numbers may not trigger concern. Together, they form a pattern. Medicine relies on pattern recognition, but patterns take time to emerge. That time can be dangerous. One of the reasons these symptoms are missed is context. When symptoms match common illnesses, the brain naturally reaches for common explanations. This happens to clinicians and patients alike. Rare conditions hide inside familiar presentations. Serious infections don't announce themselves as rare. They disguise themselves as routine. The danger is not in any single symptom. It's in the combination, the persistence, the progression, symptoms that don't resolve, that worsen subtly, that don't respond as expected. These are the moments when experience matters, noticing what doesn't fit, understanding that normal-appearing patients can still be unstable. This is why early intervention saves lives. When caught early, the body can recover, circulation can stabilize, inflammation can be controlled. When missed, the body continues compensating until it can't. Collapse is not the beginning of the emergency. It's the end of the warning phase. What these missed symptoms teach us is not fear, but humility. The human body is complex. It adapts impressively, and sometimes it hides its own failure. Understanding this changes how symptoms are interpreted. It explains why people worsen suddenly, why emergencies seem to come out of nowhere, why early recognition matters more than dramatic presentation. The previous episode showed how infections are ignored, how sepsis disrupts the body, and how the skin reveals internal failure. This episode explains why the warning signs are often overlooked long before that point. In the next episode, we'll examine what happens when blood pressure begins to collapse and why the body can always recover once it does. Because some thresholds once crossed cannot be reversed. This is Infection Archives Uncut. We explain what others miss.